Hi guys, welcome to our next session, and today we are going to discuss on trial case. In this video we shall discuss on trial case and some little about ophthalmic procedures and uses of the lenses. So trial case or trial box, it contains a set of spherical and cylindrical ophthalmic lenses which are used in performing subjective refraction and neutralization, and it contains a set of plus and minus spherical, plus and minus cylindrical accessories, spherical lenses, cylindrical lenses, prism, Maddox rod, and others. So now the basic and important things to know in lenses is how to identify a lens. Accessories lenses have unique design, so identifying them is not a big problem. Why? Some other lenses need an evaluation to identify them, especially if power is not mentioned over them, like in exam or in spectacles. And how can we try to find out whether it is plus or minus lenses, spherical or cylindrical lenses? So remember, holding the lens when the handle is present, or if the handle is absent, then you can hold on the markings, like especially in cylindrical lenses, they have no handle. So for example, if so in exam, when we are asked to identify a lenses, the first step is to close one eye and hold the lens in front of the other eye and focus on a distant object. Step 2, then move the lens in vertical and horizontal direction. Then step 3, rotate the lens. So while doing this, note the following point: is there any magnification or magnification of the image? And note the direction of the movement of the image with respect to that of the lens. Is there any variation in the movement of the lens and the image? Does the image move during both vertical and horizontal movement of the lens, or it moves during only one of them? Is there any distortion of the image on rotation? So these are the things to note while identifying a lens. So the magnification and magnification and also the direction of the movement of the image will tell us whether it is plus or minus. And vertical and horizontal distortion of the image on rotation will tell us whether it is sphere or cylindrical. So if there is magnification of the image, or the direction of the movement of the image is opposite to that of lens, then it is plus lenses or convex. If the image moves during both vertical and horizontal movement, no distortion on rotation, that means it is plus spherical. But if the image moves only during one of the movement and there is distortion on rotation, that means it is plus cylindrical lenses, because cylindrical lenses have power in one axis and the axis perpendicular to it has zero power, as compared to spherical, which has power in both meridian. So what are the uses of like plus spherical lenses? Plus sphere lenses are used for the correction of the polar refraction, like hypermetropia, apakia, presbyopia. So in these cases, the rays of light are focused behind the retina. So the plus lenses is used to focus the light on the retina. And cylindrical lenses is used for astigmatism. So these are a little details on how to identify a lenses. Let's move to the features of the lenses itself. So we have reduced aperture lenses and full aperture lenses. Reduced aperture lenses, they are always plano-convex or plano-concave. The diameter of the lens is 20 millimeter. These lenses probably give the best approximation. Its use of the lenses is to neutralize the spectacle lenses with their opposite sign. Like plus is used to what? Neutralize minus lenses. We have full aperture lenses. They are always biconvex and biconcave. The diameter of the lens is 38 millimeter. So in spherical lenses, they are present in what? Plus and minus form. The ranges, the variation is plus and minus 0.12 to plus or minus 20.00 diopter. These are the variation. It starts from 0.25 to 4.00, that means 4 diopter, with increment of 0.25 diopter. Then from 4.00 to 6.00 with increment of 0.50 diopter. Then next is 6.00 to 14 diopter in increment of 1.00 diopter. Then 14.00 to 20.00 diopter in increment of 2.0 diopter. These are the variation how they are arranged in the trial box. These are spherical lenses. So we have cylindrical lenses. They are present in plus and minus form. The range is from plus and minus 0.25 to plus or minus 6.00 diopter. The variation starts from 0.25 to 3.5 diopter in increment of 0.25 diopter and 3.50 to 6.00 in increment of 0.5 diopter. This is cylindrical lenses which has power in 1 meridian. Then we have prism. What is prism and what are the uses of prism? The prism is a portion of refractive medium bordered by two plane surfaces that are inclined at a finite angle. It has thicker portion which are called base. It has tapering portion which are called apex. So they have principle. The principle is what? Displaying image toward the apex. Always what? Display the image toward the apex. Then the prism is up to 10 prism diopter with addition of 15 to 20 prism diopter. The range is 0.50 to 1, 2, 3, 4, 5, 6, 8, 10, 12 prism diopter. It is plano thickness gradient prism. They are mounted with Beck's apex notation. The uses of prism: to measure small squint, to prescribe prism in spectacles, and so on. And the most commonly prism are trial prism, which are present in what? Trial box. Then we have loose prism. We have prism bar. It contains a multiple prism graded in a bar as progressively increasing power of the prism. So the displacement of the image keep on increasing, like in prism bar. So then we have accessories. As we mentioned earlier, identifying them is not a big problem. So we have trial frame, we have Jackson cross cylinder, we have Occluder, we have pinhole, we have STENOPIC SLIT, we have Maddox rod, we have red and green filter. What is trial frame? Trial frame is made up of metal and plastic frame. Ideal frame features are they are light in weight, which are comfortable nose rest. At least they have compartment. They have 3 to 4 compartments. It has for spherical lenses, for cylindrical lenses, for occluder and some like accessories that are used. So the triprime have 4 components or compartments. The first compartment is used for the high power lenses. The second compartment is used for spherical lenses. The third compartment is used for cylindrical lenses, and the fourth compartment is used for accessories. The compartment of cylindrical lenses has smooth and accurate rotation. The properties of ideal frame is non-allergic material, nose bridge and temple are adjustable according to the patient face. So these are all about the trial frame. So let's come to Jackson cross cylinder. The Jackson cross cylinder is a combination of 2 cylinders. The axes at the right angle to each other and mounted in a handle. The common use cross cylinders are of plus minus 0.25 or plus or minus 0.50. It is used for astigmatic refraction. The cross cylinder usually used to refine cylindrical axis and power of the lens. Next is occluder. Occluder, it is a black opaque disc and mounted in metal plastic rim. It is used for the uniocular testing and to occlude light reaching the eye. We have pinhole. Pinhole, it is a refractive, in the refractive arrow, the scatter beams of light are not refracted correctly onto the retina. This creates a blurry cycle on the retina. So, pinhole eliminates all but straight beams of light which pulse directly onto the retina, giving a clear image. So the scattered beam of light are being eliminated by the use of pinhole. Only the straight beams of light are which can focus on the retina or which allow to give a clear image are allowed to pass through the pinhole. And the pinhole, it is a black opaque disc with central pinhole of 1 to 2 millimeter. Ideal central pinhole diameter is 1.42 millimeter. So the principle, as we mentioned earlier, that it allows only one ray of light to pass through along the principal axis of the eye. So to see best corrected visual acuity, the uses of a pinhole, it is used to see a best corrected visual acuity. It is used for macular function test. It is used to analyze the opacity of the cornea in central or paracentral. So for example, if the patient is complaining of diminution of vision, ask to look at the Snellen chart, place the pinhole in front of his eye and the other eye being occluded by the use of occluder. Then he or she asks whether the vision improves. So in this case, 3 things will happen. Either the vision improves, or the vision is unchanged, or the vision is decreased. If the vision is improved, then it is a refractive error. If the vision is unchanged, then it is ocular pathology. If the vision decreases, then it is macular pathology. So this is all about the pinhole. Then we have STENOPIC slit. STENOPIC slit, it is made of black opaque with slit aperture. Slit aperture with 15 millimeter length and 1 millimeter width. It allows ray of light to pass through only 1 meridian. The uses of STENOPIC slit include to record the visual acuity in 1 meridian, to find the axis of cylinder, and to find the principal meridian. The next is Maddox rod. Maddox rod, it is a series of high power convex cylinder mounted with their axis parallel to each other. This is available in red and green colors. The principle, it converts spotlight into a line. The uses to diagnose and measure Fourier to measure a what? Conversion. So let's discuss a little on the Maddox rod. As we mentioned earlier, that it is used in indication of squint, heterophoria, subjective necessary of deviation, like the procedure. Let's talk a little about the procedure on how to text on the Maddox rod. Then the procedure of Maddox rod. This test is used to perform at either distance of 6 meters or 36 centimeters. We use 6 meters for distant chart and we use 33 centimeters for near, from bright spotlight in dark room. Suppose that the patient has a latent squint or heterophoria. Detection of latent squint heterophoria: when the patient with latent squint exophoria. So when a patient fixates on a point source of light, a single image as the phoria is welcomed by the patient reflex. But when Maddox rod is placed in one eye, the image of a point source of light becomes dissimilar between the two eyes. Then the patient becomes dissociated. So, and heterophoria become manifest. The light will fall in an area temporal to the fovea, and the image is seen in somewhere nasal. This brings about cross diplopia. In an exophoria, then cross diplopia, while uncrossed in exo and uncrossed in what? Esophoria. Cross diplopia in exophoria, while uncrossed in esophoria. Becomes in exophoria, light will fall nasally to fovea, therefore the image is seen somewhere temporally. So what is subjective measurement of deviation? In subjective measurement of deviation, place the Maddox rod in right eye. Power of the prism, the other eye keep on increasing until the orthoptic situation is achieved. Both vertical and horizontal deviation can be measured, but the test cannot differentiate between phoria from tropia. As we all know the difference between the phoria and tropia: latent and what? Manifest tropia, hidden and non-hidden tropia, or squint or strabismus. The next is green and red filters. These are red glasses of 640 nanometer, and green has 535 nanometer wavelength. Red filter is in front of the right eye, and the green filter for the left eye. The principle is to what? Dissociate the eye using color sense. Then we have the last one, which is anaglyphic glass in word 4 dot test, that is diplopia charting. What is word 4 dot test? A word 4 dot test, a gross test which provide information only about the status of peripheral binocular cooperation. Then it contains 4 dots. What is the procedure of what for dot test? So the procedure is a patient wears a red-green goggles with the red lens in front of the right eye, which filters out all colors except red, and green lens in front of the left eye, which filter out all colors except green. The patient then views a box with 4 lights, 1 red, 2 green, and 1 white. So what is the result? So we have 4 lights. If binocular single vision is present, all 4 lights are seen. You can see 4 lights if you have single binocular vision. If all 4 lights are seen in the presence of a manifest strabismus, if 2 red lights are seen, there is left suppression is present. If there is green lights, then there is what? Light suppression is present. If 2 red and 3 green light are seen, then diplopia is present. In a normal patient, all 4 lights are seen. So this is all about the word for dot test. Thank you.